So this is kind of our general overview agenda. We're going to do introductions, kind of a grounding in place. Michael, because he is the grandfather, is going to do some history, a history lesson for us all, because that's kind of what he does these days. And then we're going to talk about the transition from linear to systems thinking, and then really talk about some frameworks that we can use for deeper systems thinking, and do some exercises and examples. So we'll have earlier in the morning more of that history, and then take a break, and then after that we're going to try to dig in a little bit more to concrete. But it's still really mostly today our focus is really about just thinking differently about the way that you work and thinking in systems terms, and you're not going to come away with like a toolkit of how to do this exactly in your context, but some ideas and some ways to go out and think, and then we'll have follow-up about what that looks like in practice as we go forward. So we are going to start with a land acknowledgement. This is a map that I really love by Marlena Miles, a local native artist of the Twin Cities. And we are here on Dakota and Anishinaabe land. And we, Michael and I, are settlers on this land. My ancestors are from the British Isles, 12th generation settler here, and I want to acknowledge that and acknowledge our responsibility as caretakers of this land and recognize the history of colonialism and genocide that has placed us here, and our responsibility to address and repair those harms and really root us in the place and the context of this land. We are going to do a systems-based land acknowledgement that we have been working with a Native colleague in Wisconsin who, oops, sorry. Oh, wait, are we doing this first?
Go ahead.
Okay, we're gonna come back to this. Nicole Bowman, who some of you may know, who is Lenape and Mohican, and she has really been rooting a lot of her work in the Four Directions medicine wheel, which has, in the East, being a good relative, in the South, being of good mind and thinking, in the West, orienting our collective actions to good work, and in the North, creating wisdom that sustains and nurtures future generations. And we've worked with her to think about how to apply this in evaluation contexts, and we had a project where we were looking at healthy communities through climate and health, the intersection of climate and health, and she actually expanded this to a 7 directions model, which you'll see on the right, that includes the earthward, inward, and earthward, skyward, and inward directions. So we're going to practice living into this systems perspective and grounding us in place by having you rise and really connect with these 7 directions. So we're going to begin in the east. And as you face the eastward direction, think about your relationships, the relationships that you have with others in this room, with the land that we're on, new relationships that you want to build today, and how you will center relationships in the work that we do together. Then turn to your right. This is the southern direction, where we're thinking about the way that you're thinking about the work. What frameworks and ways of thought have you brought into this space? And how can you maybe let some of that go and open yourself up to new ways of thinking today? Then we'll turn to your right again. We'll face the westward direction. This is about actions, and how are you going to take what you learned today out into the world? How are the actions that you have connected to the things that we're talking about? And what does that look like in practice? Then you can turn again to the north. This is about the future, the lessons that we're learning. How are we taking this forward 7 generations, and really what is going to be our legacy in doing this work together, and just holding on to that. Then you can look down at the earth. Think about how we're connected to the earth and our environment, and what is the impact of what we're doing on the earth, and how does that connect to how we are in the world. And then look up to the sky and think about what are the metaphysical things, what are the spiritual dimensions of what we're doing, and how can we bring that into the space. And then finally, you can close your eyes, maybe put your hand on your heart and think about your inward spirit and how you can take this to your personal level. What does personal transformation look like in this space? And with that, you can have a seat. And hopefully that helps you feel grounded in the systems in which we're living, as well as how we're going to be together today. And we do want to just get a little bit of a sense from you about where you're coming into this space with. So we did set up a Mentimeter. If you have a device, you can just snap the QR code. Or you can, if you have a computer, you can go to menti.com and enter that code. The Wi-Fi is over here. It's Wellstone Meetings, and the password is champion. And I'll give you a second to get that up. Are you all over here able to see okay? Do you need to move to a different table, or I don't want to?
I just don't want to come back there.
Sure, whatever you need to do, but we might be a little bit in your way if we're... Is it working? Mm-hmm. All right. Yep. And I'm going to pull up the results here. So we just wanted to get a sense of your experience with evaluation, systems thinking, and then evaluating system change. Great. So hopefully by the end of this, we'll move all of these things a little bit towards the more extensive in terms of understanding. And going out into the world after this, hopefully your experience with these things will also increase. But we're going to be thinking a lot around the middle, like the systems thinking piece, and then as we go to the end of the workshop, getting into this idea of what does that mean for evaluation and evaluating system change. So one more question for the, or two more questions for the beginning. What comes to mind when you hear the word evaluation?
Can you put the QR code up again? I can closed out.
Oh, did it? Okay, yeah. Or you can go to menti.com and just enter that code. Would that work, or do you want me to go back? Is that okay? Okay. Is it coming up for others? Yeah.
No, it was me.
Oh, it's just you. Okay, got it. And if you're not on Menti and you want to just shout out a word, that is also okay, if you'd rather do that. I'm seeing learning, adaptation, change, improvement, community engagement, growth, doing better, competing values, future, intentional, inclusion, curiosity, questioning, systematic, meaning making. Learning is still right there in the center. This tells us a lot about this room because often what we see are more mixed and even negative words sometimes. So it seems to me, looking at this, that you all have a general tilt towards the positive and the usefulness and the learning piece, but we also recognize that there are a lot of different experiences with evaluation when we come into a room and wanting to honor that. And our hope is always to make evaluation useful and relevant to the work that you're doing and as something that you feel excited about and wanting to do. And particularly when we think about having a systems approach to that, that it really is based in the realities of the lives and the communities in which we're working. So, final question for the morning is, what are you hoping to get out of today's workshop? Creative thinking, something, okay, well, hope to do that. Update my skills, inspiration, be transformed, be a system change evaluator, get better at evaluating complex system change, better understanding of evaluation as much as possible, framework for thinking about evaluating large-scale PSC, explain the impact of work, new ideas, learning about systems thinking, transformed thinking, ideas about how to capture change in community, learn while having fun, meet new people. All right, wonderful. Well, we'll try to get to as much of that as we can, and we'll check back in at the end to see how we did. So I am now going to pass the mic over to Michael.
Hey, hello. Glad to be with you and to share this transition that we're all in the world and in the United States and in extension. I want to give special recognition to my colleague Jean King, who is here. We've been on this journey together for a long time. Nice to see Jean. So I am going to share some of the history that has brought us to this place. I began, most of my career was with Extension. I began with Extension as a Peace Corps volunteer in the 1960s. During the Vietnam War years, I had the opportunity to either get drafted or to go to Peace Corps. I decided to go to Peace Corps. In Burkina Faso, when then it was still Upper Volta, and did 2 years of agricultural extension among the Gourma people. Gourma was what the French called them, their name in the Guermanche language for human being. What they called me was bon piano, which translates as white thing. And in most of the villages I worked, we were introducing very subsistence kind of agriculture, millet and sorghum. We were introducing some improved varieties and expanding into some cash crops, cotton. I built a couple of schools for local folks, and we put in wells in that region. It's now overrun by terrorists. Burkina's in very difficult straits, and the Sahara Desert is moving south at the rate of 25 miles a year. And that area is very difficult. But I had the opportunity a few years later to help launch the African Evaluation Association in 1999 in Nairobi, and was hoping there'd be someone from the Gourma. They're one of the minority tribes. There are 46 tribal groups in Burkina. The Mosi are the dominant group. But as it happened, there were 3 representatives from Burkina, one of whom was Gourma. I sought him out. We had lunch at the UN compound outside of Nairobi. And I was catching up on what had gone on. The road between Ouagadougou, the capital of Burkina, and Niamey, the capital of Niger, had been paved. All the international agencies were working there now. None of them were there. Peace Corps was one of the first development groups in. There had been several changes in government I knew a little bit about, a couple coups d'etats. And in the context of talking about that, I reminded him that I had been called bon piano when I was there, and thinking a certain, shall we say, political correctness might have reached the bush. I said, if I came back today, would I still be bon piano? He said, no, we wouldn't call you bon piano now. I said, so what would I be called? He said, wan piano. I've been away from the language a long time. Wan piano? Yeah, old white thing. Which is how I come to you today. With the miles that suggests and the limited perspective that suggests. I came back from Peace Corps and got my doctorate at the University of Wisconsin in rural sociology and development, and came to Minnesota in the first evaluation methodology training program that existed in the country, and became director of that program that included working with Extension. And I subsequently had an appointment in Extension. I was in Extension at the University of Minnesota for 15 years. Did an international project, an USAID-funded project in the Caribbean for 10 years, developing extension systems in the Caribbean. I was the editor of the Journal of Extension for 6 years, and the future editor for 3 years. And so have lived through a number of changes that I think are relevant to how we got here. And so I'm going to do a little bit of that includes looking externally at some of these issues. Let me come back here. Yeah. This was an old Extension cartoon, actually, that we used in training. And that's part of the systems piece that Charmagne took us through, looking outward and inward. So, as Cornel West said, you can't move forward until you look back. So I am going to take a little time to take you through some of the transitions Extension has been through. And some of the old-timers will recognize this, and the influence of Extension on the field of evaluation. I'm a former president of the American Evaluation Association. Dick Kruger has been a president of AEA. And the very first conference on systems for the American Evaluation Association, Jean was program chair at that time, was when Molly Engel was president, and she was the extension educator from Oregon State, and chose systems as the topic for the American Evaluation Association. And so, going way back, the Morrill Act in 1862, the Hatch Act in 1887 gave rise to the extension, the land-grant universities, the University of Minnesota, and the Smith-Lever Act in 1914. Then Minnesota Extension created in 1909. 17 Minnesota counties named extension agents in 1913. And Minnesota Extension law amended to reflect county differences and more financing. From 1913 into the 1950s, every Minnesota county had an extension office. Minnesota Extension began as place-based. Every county office was place-based. It was to serve the people in that county, to know the problems of that county. Included both an agricultural extension agent and a home economics agent and a 4-H agent. The last edition of the Journal of Extension that I edited was about 1979, and within 3 years, Minnesota had wiped out the county agents. My last futures edited was, the one thing that will endure is there will always be county extension offices. So my futuring cred is not great in that regard. And that was a huge surprise to me because the extension offices were so deeply place-based. The extension agents in a county, knew the people in the county, were trusted sources. But part of what was affecting that was budgets, county budgets, and the internet, and places where people were getting information. And so all of those changes meant that extension began to go regional, and the financing changed along at that same time. And then we get into the expanded food and nutrition education program in 1968. EPNEP piloted in Minnesota what would become SNAP ED in 1979. And this became a major issue. Minnesota changed its name from Agriculture Extension to Minnesota Extension. And in 1990, they expanded from the focus on agriculture and home economics to education programs, reinventing Minnesota Extension for the 21st century in 1992 with the county clusters. And then the University of Minnesota got into Climate Adaptation Partnership in 2008 and 2000, 5 capacity areas, agriculture, food and environment, community vitality, natural resources and environment, youth development and family development. Then we get to PBA in 2019 and 2024. But before that, we've been through some systems things along the way. In going back to my graduate school days, my dissertation was based upon the work of Everett Rogers, his Diffusion of Innovations, and Bennett's Levels of Evidence. Everett Rogers wrote the classic book, 1962 it first came out, on diffusion of innovations, and that has become the Bible for extension. What evaluation and extension have in common at its core is that extension was about diffusing knowledge to support innovation and adaptation, and evaluation is about figuring out what innovations work that ought to be scaled. And so the task of the evaluation to determine what works that ought to be spread, and extension figuring out what the research base is that ought to be spread, has been hand in glove. Everett Rogers is now, this is an edition that just came out a year ago, continuing to keep that up to date. And it was the basis of much of the work that we still do. He's the one that created the early adoption theory, that you work with early adopters and spread along the curve. That's Everett Rogers, going back to 1962. And then a huge breakthrough was Claude Bennett's Levels of Evidence. In 1976, he published this, and it was looking at the ways in which we go. This is the predecessor of the logic model, going from resources into activities, participation, reactions, CASA, knowledge, attitude, skills, and aspirations, behavior changes, and impacts on long-term conditions. This came out of extension. Claude Bennett was a senior federal extension officer and had a huge effect upon all of evaluation as we moved into logic modeling. The levels of evidence then turned into a sequence of greater impact. And looking at how the levels of evidence then became a basis for logic models and theories of change, theories of action, has been the influence of extension on the entire field and our own work. But at University of Wisconsin, developed with the Kellogg Foundation what remains the most widely used logic model handbook that many of you have experienced. Logic models have gotten more complicated and multidimensional over time. We've gone through the farm crisis using logic models and theories of change. And what came out of the farm crisis in the 1980s was a major initiative on what was called farming systems. And Minnesota Extension adopted a farming systems framework. In 1980, I taught a course on farming systems at the University of Minnesota. Farming systems efforts were interdisciplinary, field-based, collaborative, comprehensive, inductive and exploratory, both qualitative and quantitative, sensitive to context, interactive, dynamic, and process-oriented, situationally responsive, and adaptive. Very close to the values you have and very much overlap with place-based. Farming systems work was essentially place-based work. But the place was the farm. And what the breakthrough here was that agriculture, departments of agriculture are based upon specializations. And extension had historically brought those specializations. If you had a problem with plants, you saw a plant specialist. If you had a problem with soil, you saw a soil specialist. If you had a problem with trees, you saw a forest specialist. And farming systems recognize that solving individual problems, in fact, the whole metaphor of the root problem was an agronomy metaphor. It didn't look at the whole system. A root is simply giving you a place to look to see what the larger issues are: water, disease, fertilizer, labor, marketing. And so farming systems expanded from the specialization into interdisciplinary work. It didn't last because universities can't genuinely do interdisciplinary work. We talk a good story, but in fact, the incentive system of universities remains specialization and individual reward in the tenure and promotion system. I worked for 3 years at the University of Wisconsin with the Gaylord Nelson the Environment Center that Gaylord Nelson established. It's one of the major environmental centers in the world. And for 3 years, all the departments in the university, especially in the biological and agricultural sciences, strategically worked on creating a genuinely interdisciplinary system. And at the end of 3 years, the deans and department heads voted against having any tenure connection with the Institute. That they wanted all of the tenure decisions to remain at the departmental level and would not give faculty any tenure credit for doing interdisciplinary work. And so when we look at the work that we do out in places, in the communities that you work in, we have to also look at the system that we are a part of and the limitations of that system for doing systems work in the world. It's a major constraint. That became, today, agroecology. Farming systems has become agroecology, which is a major effort internationally. The McKnight Foundation here is a major sponsor of international agroecology work, has major programs going on in Latin America, South America, and Africa. Jane Malin Cady, who's the program director of international programs for McKnight, came through the farming systems program and was in the class that I taught back then and was my graduate student. This work has been carried internationally, but it hasn't survived well in the United States. And then we get to the family systems piece, which became a major focus at about the same time in home economics, moving from specializations into family systems, looking at, this is from Dr. Seuss's If I Ran the Zoo, where young McGregor McGrew is looking for exotic animals and comes across a family of deer whose horns are so interconnected you can't tell where one begins and the other ends. A beautiful depiction of family systems. And people working in addictions and mental health came to understand that you have to deal with families, not just individuals, and that the family interventions are more enduring and sustainable, which gave rise to moving from home economics to human ecology. And just as farming systems was meant to be interdisciplinary and applied, human ecology was meant to be interdisciplinary and applied. It studies the relationships between people and their social and physical environments. It is an extension of concepts drawn from ecology to the social realm. The human ecology approach focuses on human adjustment to physical environments. The United Nations Conference on the Human Environment in Stockholm in 1972 made human ecology a major focus, as humans were perceived as one species among many, removing human exceptionalism from the framing that interact with bounded environmental conditions. But what human ecology does is reverse that. Human ecology is the big picture of the ecosystem. Farming systems is one part of a ecosystem, but it broadens that view. So Wisconsin created the Extension Human Ecology Partnership, which they say manifests through the work of several integrated specialists, tenure track faculty and academic staff with expertise in family health, food security, financial well-being, maternal child health, and caregiving. This is a beautifully crafted statement that makes it appear that people are actually working interdisciplinarily. Integrated specialists, emphasis on specialists, the integration part, not so much, and They still call it the School of Human Ecology, but what they have are programs in agriculture, community development, human development, health and well-being, natural resources, positive youth development. They're not doing integrated ecosystem work. They're not doing ecology work. So all of this is, without being hopefully cynical, is to say what you're trying to do is hard. It's hard on the outside, it's hard on the inside. The barriers are substantial. We're going to move into the thinking involved in actually taking a systems approach, both at the farm level and at the community level, at the ecosystem level, why that is so important. And I wanted to let you know that there is a long history here that you're a part of bringing that perspective into extension and into the work. But the resources, the staffing, the training to do that, real systems work has to be teamwork. It has to be interdisciplinary work. It has to be connecting people and knowledge together across the ecosystem. And that is not easy work to do. And we're going to look at some of the barriers, but also some of the possibilities. And Charmagne will get into frameworks that allow us to move in that direction. So what Bennett's hierarchy gave rise to was SMART goals that are specific, measurable, attainable, relevant, and time-bound. And this is where our history as evaluators comes in. When we started, and I was there, the program here in Minnesota was the first, we thought what we were going to be doing, and it was how evaluation was defined in the early days, that what we were doing was measuring goal attainment. We would go out and find out whether or not programs attained their goals. And we went out to start doing that. And what we found was programs didn't have goals. In fact, they didn't have programs. They had a lot of busy people doing a lot of stuff, but it didn't seem to be directed at anything. And those folks were perfectly happy with that. You know who needed goals and programs? Evaluators. Because that's what we were going to evaluate. And so we moved from the back end, going out to find out if goals were being achieved, to the front end, writing the damn goals. And doing the logic models. And we did excellent work with making goals specific, measurable, attainable, relevant, and time-bound. Not always the goals that the people working had, but they were the goals that we had for them, and that we could measure, that we could evaluate. And we got in the logic modeling business. So it moved us from the back end, how did things come out, to the front end of helping design. Now what's important about this, for what we're talking about this morning, is that evaluation, and we think appropriately, because a major principle of evaluation is evaluators ought to be involved from the beginning. But it means that the frameworks we bring to the table and how to think about what an intervention is has huge consequences. And the tools that evaluators have developed over these years are SMART goals and logic models. Theory of change gets added in when you identify the mechanisms in the logic model that bring about the change. How does the change happen? A logic model just has to be logical and sequential, a set of steps. Theory of change has to say why that works. So, logic model assumptions then they're linear and sequential. They have discrete outcomes. They have a well-specified intervention. They have direct cause-effect modeling. They have clear boundaries in a closed system. They have control over inputs, activities, outputs, and outcomes. And as they've developed, they've gotten feedback loops. They've gotten many more boxes. This is called a logic model from CDC. It's actually an organizational chart. It's not a logic model at all. And when United Way adopted logic models, which they did without being able to train anybody in how to do them, the mistake that folks have made over time and still make is think that the issue is to see how much crap you can put in the boxes and ignore the fact how they're related across, which is the point of the logic model, is what's going on horizontally. But people thought, oh, these boxes here, we can't just have a little thing at the top. We better fill that up with lots of stuff. And that's how we get this kind of stuff. And then Carol Weiss, one of our great pioneers, a dear friend and a mentor for me, one of the leaders in thinking about use, was at a major conference on anti-poverty programs that Extension was a part of at the Aspen Institute. And she was, in 1995, she was aghast that all these program staff in foundations and people in academia were sitting around designing programs for poor people, to affect poor people and reduce poverty, and knew nothing about the research. They're just making stuff up, just making up programs, what they thought would work. And so she is the one who introduced theory of change, which we would say these days went viral. She wrote this article, "Nothing as Practical as Good Theory," expecting, in fact, that a theory of change would actually specify causal mechanisms, would be research-based, which is what Extension's based on, theory-driven, and deal with larger units of analysis beyond projects, complex, multidimensional initiatives. So we moved from the back end to the front end, and we did that with a little bit of subtlety because it wasn't exactly politics to go out to programs and say, do you people realize you have no idea what you're doing? You have no goals and you have no program. So instead of saying that, we said, we'd like to begin with this little thing we call an evaluability assessment. Let's see if you're ready for evaluation. Like, do you have any goals? And do you have a program? So traditional evaluation has gotten very good at evaluating programs and projects, clusters of grants, goal attainment, outcomes, implementation, using logic models and theories of change, generating findings, judgments, lessons, and recommendations. We've nailed that. There are lots of good tools. The evaluators in this room are all trained in that. Many of you are trained in that on the program side. That's traditional evaluation. That's the world of projects and programs. But the world we've moved into is asking for evaluation of mission, strategy, advocacy campaigns, policy change, systems change, complex dynamic interventions, community impacts, regional initiatives, environmental ecosystem sustainability, networks and collaborations, leadership, inclusiveness and diversity, innovation, collective impact, scaling, principles. None of these things are projects. But what we do is turn them into projects, because that's what we know how to do. We turn them into logic models and SMART goals. But what they are systems change as a big umbrella. As Einstein famously said, we cannot solve our problems with the same level of thinking that created them. And the project level thinking has actually exacerbated problems by separating them from the systems of which they are a part. I've been at this for over 50 years, going on 60 years, and I've become convinced, as a foundation for what we're talking about today, that effective programs are effective because they manage to cut themselves off from the dysfunctional systems that surround them, and that projects and programs that fail because they are crushed by the systems that they are a part of. And so dealing with that larger context is what we're going to get into, is what that change represents and the challenges of doing that. And keep in mind, we're talking at dual levels here. The reason I went through this history, we're talking about how change occurs out there. We're also talking about how the institution functions as a system. how extension functions, how the university functions, how you function in your work. So systems transformation is inherently emergent. It happens through decentralized actions of many diverse actors. It's cross-scale, across different categories of things that go on, different specializations. It's often nonlinear. Small actions can have big reactions. Big actions can have small actions. It's cumulative, and it's often resisted. Part of the challenge of doing it. The characteristics of systems, you're all aware of this, you know the lingo. The parts are interdependent, such that a change in one part changes all parts. The whole is greater than the sum of the parts, consists of interconnected relationships. Boundaries are socially constructed, perspectives vary, and systems are made up of subsystems and function within larger systems. So that's the rhetoric, but we're going to get concrete about what this means. I'm going to have you at your tables identify what systems come into play in a passionate kiss. Now, I'm assuming you all have some passing knowledge of what this phenomenon is. You've at least seen it in movies and TV, or you may have had the experience this morning or last night. But whatever, take just a few minutes at your tables to get your head into systems. You could do a logic model of a passionate kiss, but we're not going to go there. Instead, we're going to have you think about what systems come into play. If you want to understand a passionate kiss, what systems come into play? Just take 5 minutes and talk to each other about this. I won't do more than 5. I'll lose you all together after that, but we'll get a little taste. So let's introduce yourselves if you haven't met the people at your table. Let's do the physiological parts first, then we'll get to the culture. What are the other physiological parts? Hormones? Oral? With or without the hygiene? The passion trumps the hygiene. What? The proximity. Got to be together.
Health. You have a cold.
Health. All the senses come into play. You know, that's part of, so the touch, what we see, what we smell, what we feel, the lungs, the cardiovascular system. In fact, the whole point of being passionate is all of our biological systems begin to act and interact with each other. Then we get the context, who's present, the cultural piece, and the family norms, religious norms. There are places in the world where it's illegal to kiss in public and where the penalties are quite severe. You may recall 5 years ago, the Hollywood star Richard Gere was in India and he publicly kissed a Bollywood star, and the Parliament of India put out a warrant for his arrest. He barely got out of the country and to this day cannot go back to India. In medieval times, a kiss was a marriage contract. And at various times, there are different kinds of regulations around kissing. 5 years ago, in the London subways, they put up signs prohibiting kissing. Not because of health concerns, but because trains were being delayed by soft-hearted conductors while people were having long, lingering goodbye kisses. I don't know who gave them the logic model that putting up a sign would stop people from having passionate goodbye kisses, but I don't think that worked out too well. And then kissing has economic, the kissing that goes on in commercials to get people stimulated, the sexual innuendos. In Paris and Rome, during the summer, the Ministry of Tourism hires actors to go to romantic places in Paris and Rome and make out to help Americans get in the mood. Because people from Paris and Rome won't go to those places because they're Americans there trying to get in the mood. And that's a downer. So they hire actors to walk along the sand, hold hands, make out to help us And that supports the tourist industry. So the legal system, the cultural system, the family system, the entertainment system, the political system, all of these come into play. Now, the point, you'll see, where we're going with this, you can take something as simple as a passionate kiss, but to understand it, you have to look at these layers of systems, from the individual biological system to the pair of people, their biological system, to what they're surrounded by in terms of family, history, the time that it's happening, the era that it's happening, the place that it's happening, and the implications of that. Understand that these things come into account, and the same kind of thinking then is what we're looking at when we take any phenomenon and begin to say, what are the elements and the systems that intersect around that phenomenon? What we've traditionally done with logic models and programs is identify a problem and attack the problem. What systems thinking has us do is to place the thing we think we're concerned about within a larger system of relationships. And so we've begun to understand that things like racial discrimination is not just about individual interactions, but it's systemic, structural racism. And we saw after George Floyd's murder a great deal more attention given to structural and systemic racism. We've seen that happening with the environment, the ways in which everything that we do as individuals, as groups, as families, has environmental implications. And that then has implications for how you move from a problem definition that says we've got this problem we're going to work on, to understanding that that problem is a systemic issue. What's the system and the related systems around that? We're good. So the most common system story that's told, you all know the story, the 7 blind people and the elephant. So as you know the story, one person touches the side and says an elephant's like a wall, another touches the ear and says it's like a fan, another the leg and says it's like a tree trunk, another the tail and says it's like a rope, another the trunk and says it's like a snake, another the tusk and says it's like a spear. And the moral of the story is that you have to put all those parts together. It's indicative of how far we are from systems thinking that that's treated as a system story. It is not. It's a linear reductionist story. It's taking apart the parts. And that's what linear reductionism is. You take something, you take a problem, and you look at its parts. You take it apart, and you look at its parts. What systems thinking does is look out around the thing of interest, so that no matter how long you study, and how many autopsies you do, and how much you examine the parts of an elephant, an individual elephant in a zoo, you won't have a clue about an elephant. You have to go to the elephant in its natural evolutionary place, in the jungles of Asia, the savanna of Africa. Elephants are very social animals. They operate in matrilineal herds, taking care of the young. And to understand elephants, we have to understand them in relationship to the flora and the fauna in the ecosystem in which they've evolved. And as they've moved with other herds and animals, including encountering human beings and the human system and the ivory trade, understanding the elephant then is to look at relationships, interrelationships, not the parts of an elephant. That movement then into the social, matrilineal, ecosystem-based way of thinking applies to the work that you do programmatically. So there's a relationship between how we think about these things and what comes out in our conceptual frameworks. So I'm going to take you through converting a classic extension education program into a systems intervention. This is a real program for a teenage pregnancy education program. It begins with the inputs of staff and location and funding, and then the program reaches out to pregnant teens. This is a program aimed for unmarried pregnant teens in poverty. The teens participate in the program as an output. The short-term outcomes is that the teens learn prenatal nutrition and self-care, increased knowledge. The intermediate outcomes is the teens develop commitment to take care of themselves and their babies, attitude change. The longer-term outcome is they adopt healthy behaviors, no smoking, no drinking, attend prenatal clinic, eat properly, and the impact is to have healthy babies. The CASA pieces are there. This is right out of Claude Bennett. It's the classic logic model. What's the target of this logic model? To get there, who's the program targeting? The mother, the individual young woman. And this is the most common strategy in the world. What's the strategy of this program? It's the education model. Give people information and they will change behavior. And we have 50 years of evidence that that doesn't happen. Because behavior is rooted in systems. Information is one part of that system, but it turns out not to be the dominant part. There's a small proportion of the population that's ready for information to make a difference behaviorally. Most it doesn't affect. We have to come at behavior in multiple kind of ways. So this model takes the individual autonomous young woman and gives her information that's going to supposedly change her behavior. What do we know is the most important influence on youth behavior? Their peers. These appear to be immaculate conceptions. There are no fathers involved in this program. But if we took that knowledge you all know, that peer influence is important, and we change this from simply targeting, giving the young woman information to have a healthy baby, and say, how can we strengthen her system of support? What we did in a program that McKnight funded some years ago was to, at the beginning of the program, instead of doing a pretest of knowledge and behavior, we gave each young woman a flip chart, 20 young women, and markers, and asked them to draw a picture of their support system. Who in the world was important to them? Could be parents, family members, peer friends, child's father or peers, teachers, prenatal, anybody. They would each draw a simple map of their support system and then be invited to bring at least 2 of those people to the program to make it an intervention into her support system, not treating her as a simple autonomous individual, but strengthening her support system, moving from an individual information to behavior model to it takes a village model. At the same time, when we did that with this initial group of 20 young women, 2 of them had blank pages. No one in the world that they were in relationship with. And 2 of the other young women said, well, I've got a bunch of people who help me. You come be part of my group. And so right away, the very systems intervention was changing systems, was changing relationships. And they then, when we started looking at the things that affected and influenced them, the next layer of systems work was to look at how that program was connected to other interventions. The education program by itself is a small part of having a healthy baby and her support system. The prenatal clinic is going to come in, the hospital, the medical. She's going to, all those things you came up with on A Passionate Kiss come into having a healthy baby. The political system, the welfare system, the transportation system. One of the things that we looked at was inviting the young women to share what media they were a part of, what movies they watched, what things they were in social media, what music they listened to, and what that music said about them. And then they created playlists that were positive and affirming for themselves, taking control of that entertainment system that surrounds what's going on in their heads and with each other. They went down to Hennepin County Medical Center to get their prenatal. We did a focus group with them. That happened the third week of the program. Did a focus group. Every one of them said, I never want to go back to that place. They had vouchers, which meant people knew they were poor and unmarried. They were made to wait a long time. They said the nurses talked down to them. The doctors didn't even see them. They were treated like crap, and they didn't want to go back there. Well, the program's an education program. But one of the people knew a midwife at Hennepin County and said they started thinking about, could we send people in groups, send the young women in groups so they could support each other? We have a staff person go with them. We'd have to get more resources to be able to do that. And for this one time, because they use their system connections, who knows what are the options we have. For the early parts of the prenatal care, they actually managed to get an emergency vehicle and midwife to come out to the program and do the exams on site. The young women were so moved by that, they were in tears, that somebody would go to that trouble and take their feedback into account. The participation throughout that program was 100%. Because of how they were treated, because of the care and respect that they were given, and because they were not coming alone. They were coming as a group. And of course, that support system was important not just during the pregnancy, but afterwards. So you're strengthening a system of support and beginning to make connections among these silos that are what's ultimately going to lead to a longer-term sustainable system. Now, this isn't difficult. It's simply changing the question that we ask. Instead of saying, what information do we give to change behavior to have a healthy baby, we ask, what system is a person a part of that, whatever the issue is that we're dealing with, that affects their behavior, who's connected to that, what institutions are connected to that, and how do we create interconnections in those relationships that will help move the behavior and the community in the direction that we think is healthy, obviously with their collaboration and participation. And so in the Wisconsin Extension Manual, they have at the back a set of exercises to help people develop logic models. And I just want to take a couple of these and have us go through the mental process of rethinking this from a logic model to a system. So this is practicing distinguishing outputs from outcomes. Nutrition education programs. Their outcomes were older adults increased the amount of calcium-rich foods they eat. A series of lessons on healthy eating was taught in collaboration with a drug treatment program. Participants served more than one kind of vegetable to their families every day. Participants report savings as a result of wiser spending at a grocery store. 75 adults have consistently attended all nutrition workshops. So a set of isolated outcomes. What's the larger system issue here? Instead of setting targets for SMART goals, what would be the system to intervene with?
Food access.
Food access? Let's expand that.
I mean, it seems like it's all at the individual level. It's only looking at the individuals who participated in the program.
Yeah, so if we begin with the individual and what determines their food choices, which is economic and social and cultural, everything that came up in the Passionate Kiss that affects people's food choices, and then the system around that, what food is available to them, and the choices that they make there, the places that they get food, the cost of food, what they can afford, and you begin to look at, with an elderly population, for example, older adults, that the population of older adults and their nutritional and eating habits are likely to be different than younger people. And then when you look at where, at the individual level, where that system operates, the biggest parts of the food chain are institutions, school lunches, hospitals, workplaces, cafeterias. And so you get into a larger look at the food system and how nutrition becomes a part of that. Food safety. The Serve Safe education program is working with 80% of all food service managers. Food poisoning dropped. Food service workers reported increased knowledge. Food safety skills were taught to state fair vendors. Food safety information in English and Spanish is available on the university website. So a discrete set of outcomes and results. But the larger system issue here is handling food. And I actually was a part early on of doing some evaluation of a couple of these programs. One of the effects of increased food safety handling procedures was more food waste. Becoming more rigorous about handling food for safety dramatically increased food waste. An unintended consequence that wasn't looked at all because you're only focusing on the food safety piece of it. And the waste and safety are both issues around where the food comes from. And the food chain again. Now, the wisdom here, so you don't feel overwhelmed, is we can't take on everything. When you move into systems, people immediately start, oh my God, there's so many things to take into account. The wisdom is moving out a little bit to within 2 or 3 nexuses of what the main thing is that you're trying. We can't take, everything is ultimately connected. We don't deal with all of that, but we move out from the individual to the family, from the family to the community and the institutions that they're a part of. So moving from isolated inner outcomes, and even an interesting exercise, we won't have the time to do it today, but I just put it in your heads, would be to look at the connections between food safety, small business development, youth development, and nutrition education. How are those things interconnected at a community level? So the beginning, the last thing I'll do before we take the break, got time for that. The beginning of systems thinking, as it is in any evaluation, the logic of evaluation is to be clear about where you began. What's the baseline? In logic modeling and SMART goals, the baseline are individual indicators, and most of our work is about measuring individual changes. We know how to do that really well. That's why we like to do it. We know how to do pre and post tests, and we know how to measure participation, attitude, knowledge, behavior. With systems, we also need a baseline. So when you move into a systems analysis on an issue, you look at what's the baseline system. In that teenage pregnancy example, we started with each young woman, what was her baseline system of support? And then what was the baseline of that program's connection with other programs? And it was informal and ad hoc. So that's the baseline. In any ecosystem, you start with how does the system function? What are the elements? Who's connected to who? What are the relationships? And Charmagne will show you more about what the elements systematically of that can be. But I'm going to show you a baseline that those of you in the cities are familiar with. The baseline for the light rail between Minneapolis and St. Paul. There is a national initiative called the Living Cities Integration Initiative that Minneapolis and St. Paul joined to look at how infrastructure affects poverty, affects housing, affects income, affects jobs, and with the understanding that the light rail system that's being built in the Twin Cities is going to affect all of those things for the next 50 years. So this was an effort to get at the baseline. It was called the Corridors of Opportunity Initiative. The region's transit corridors are healthy and vibrant places where people of all incomes, and especially those with the greatest need, can live, work, play, and climb the economic ladder. They wanted to advance pioneering work and bring new techniques to the Central Corridor, bring the lessons, techniques, and implementation resources learned to the next in-queue lines, because that would be the first light rail, examine and change regional policies, delivery systems, and organizational structures to institutionalize and scale success, use existing promising systems to align and leverage resources. So they're going to look at affordable housing preservation along the light rail corridor, small business support, using a SWOT analysis to institutionalize new approaches, enhance the region's decision-making structure around transportation investment and land use decisions. And right as this was all getting discussed, August 1, 2007, the bridge came down. As it happens, my partner and I had been part of a kayak project cleaning up trash along the Mississippi River. 2 weeks before this, we had cleaned up the trash under the bridge. It collapsed on the clean space. What this did was, this was also when Obama was coming in then with huge infrastructure money for shovel-ready projects. And light rail was a shovel-ready project. It could be expedited. Anybody that wanted anything on that new bridge, pedestrian, bike lanes, cable, light rail, all of it got put in. They got it back up in a year. So we did focus groups with 12 different stakeholder groups, small business groups, nonprofit groups, community groups, elected officials, the big businesses that were along there, Target, their managers, and the utility companies. The light rail between Minneapolis and St. Paul has 48 different regulatory bodies involved. The people who do streets, who do water, who do electricity, and you know how well they coordinate what they do, you know. So the water people tear up the road one day, and a week later the electric folks are in doing the same one. And basically what this baseline map shows is that these are all silos, that these folks aren't interacting, but they all affect what's happening there. These are neighborhood and advocacy groups that come into play. They have control over the land, they have control over housing, they have control over and you've got 2 cities, 2 counties, the state, the regional, metro region, the federal government, neighborhood associations. That's the baseline map, not talking to each other. And down here are the citizen advisory groups and the residents. By law, they have to have hearings on this, and anybody can go and speak to them for 3 minutes with no response. So for 3 weeks, there were hearings with the Metropolitan Council and other major players who simply listened. And part of what they listened about was the history. Can't quite see this down here. Is that when I-94 was built, it went right through the African American neighborhood, the Rondo neighborhood, where one of your place-based projects is, and destroyed the cohesion of that African American community. And there was great concern, that history still lingers, about how light rail was going to affect the communities going through the Hmong community, the Rondo community, what was going to happen there. So that's a baseline of what a system looks like. And then we also, in the focus groups and with these groups, looked at what kind of system they wanted. This is kind of paled out. But basically, the vision was that with land use, community engagement, workforce development, community development, affordable housing, and transit being interconnected, that there were 4 different groups of people who have to make collaborative decision making on those things if issues of equity and sustainability and a different way of engaging was going to happen. Down here, New Collaborations Networks is a network of bringing together the people who are in leadership positions in all these agencies to talk to each other about the light rail, to share information, to help make decisions at the top level. And when we interviewed them about their rules of engagement, how their system works, how does the leadership, what are they willing to participate in coming together? They all recognized that that was important to do. They wanted to do it, but they were very clear. I will participate as long as other people at my level participate. The moment you send me your deputy, I'm sending my deputy. And then when the deputy sends their deputy, and they know that's how the system deteriorates. The muckety-muck show up at the first meeting, then you get the lieutenants at the second meeting, then you get the lieutenants at the third meeting, and pretty soon nobody's there. So they said, clear rules of engagement. Here's how our interaction system is going to operate. These are the people in charge of things in the ground. So these are the people who work for them. The people who are actually making decisions about when the potholes get torn up and when things get laid, operational people. They realized they needed to talk to each other. They needed a network. But they said, connecting with all these other people, it's a great idea. Everybody puts their stuff on the table at the same time. No round robin. Everybody undresses at the same time. Here are our numbers. And these are the data people, the evaluators, the people who control information. Every one of those 46 groups and others have data that they hoard because their power comes from hoarding data. And they said the same thing. We got to get permission of these folks, but we'll share our data if other people share. And so this is a changed system of relationships and interactions. They got some early wins in how it worked, but that vision then of working around the vision of the corridor became a different way of operating, begins with a baseline system and moves into the vision, and then you figure out what you can do in between. This is clearly a place-based. It's 11 miles between Minneapolis and St. Paul. There were political issues around each station, and they had a set of working principles, a set of contextual factors to take into account, and that's how the light rail unfolded.
Stop here.
I'm going to stop here. Charmaine's going to take you through this simple diagram later on.
This was from Hinton.
But so what I've tried to do is give you a sense of the history that we've come out of, the efforts to do farming systems, to do human ecology, to bring systems thinking into our extension work, the challenges of that within who we are as an extension and as a university, and the societal recognition. We're seeing the language of systems change everywhere. Philanthropy is talking about systems change. The government units, the campaigns were about changing systems. So the time to make that real is now. And extension has always been on the leading edge of how to do interventions. That's why I went back to Claude Bennett, to the early work on logic models. We've influenced the entire planning and evaluation fields by the ways that we thought about how to make change. And now, this is a chance again to test, can we move into some genuine systems thinking and work at a practical and meaningful level? And when we come back from the break, Charmaine's going to tell you how to do that.
And as we transition into sort of bigger picture systems thinking, to thinking about how we can apply this, particularly in the realm of evaluation, I wanted to give Mary a chance to also ground us in the PBA model and how that has emerged and the ways in which systems thinking has been part of the development of that model, so that we're really rooting ourselves in the context of what's already been done. So I'm hand it over to you.
I just wanted to acknowledge the person who helped us kind of navigate our health and nutrition program, our SNAP Ed program, into the realm of kind of a place-based approach model. And that was, at the time, our funder at the DHS, Jessica Rochester. Say hi. Jessica Rochester and Carrie Lindquist were our SNAP Ed program manager at DHS. And they had the amazing foresight to say, we need to fund our tribal grantees as well as extension. We love you and we love the university and you guys do amazing work, but you can't do the work on tribal lands, and they need their own funding, and they need to be able to be the creator of their own work. And we said, yes, we'll play, right? And so then we worked with, and then they brought us all together, all the tribal grantees. How many were there at the time, Jessica? 6? And extension. And they also had the foresight to bring in an external facilitator to help to facilitate a collective mindset for all of Minnesota SNAP Ed work. We have a gigantic university program, and we have these 6 tribal nations programs. How can we collectively, with the state, figure out what our 10-year vision for our work is going to be? And university, you're really big. We don't want you to have all of your people coming. Only send a few so you don't overpower the conversation, so that we have a more equitable conversation about where we're going to go in the next 10 years. It was a profound experience. We were a little bit caught off guard because the facilitator was a little mean. But she got us to a place that we needed to. And I would say just the kicker of that meeting was all of extension, all of us sat there and went, they have a pretty amazing program model that they've invested in their communities for decades. They had a what we call a community-based, community participatory, I stay engaged for the long haul, I'm not gonna go away. We are going to be doing this work together. And so, given that we're part of the university, we're just like, okay, we need to figure out how we catch up to that as a system. How do we catch up to the tribal grantee partners and how they do their work? And we kind of landed on, I think, Emily and there's a bunch of people going, what do we do next? Like, how do we think about this work? And we did find, because SNAP Ed requires that you have an evidence-based curricula or evidence-based to your work, we had to find something that has an evidence, strong evidence of impactful changes happening, and that was at the time place-based approach. It had a model, it had methodology, it had shown impacts in around the world in some of the lowest or highest poverty contexts. So we landed on place-based approach, and we've been struggling with that now. How many years has it been, Jessica? 6 years maybe? 5, 6 years? And we've been figuring it out. You guys didn't get any. You didn't get a map of how to do it. You didn't get how-tos. We tried to give some how-tos, but people were out there figuring it out and doing it in their communities. And we're landing in some really beautiful places, as you can tell by 20 place-based approaches that have given some information about how they're doing and what they're doing. And what we realized in all of this is we're out there doing stuff, and the evaluators are coming and going, what are your goals? What are your, what's the program? And they're going, well, I don't know how to talk about the program because it's all over. It's this and it's that and it's this. And so we haven't figured out how to evaluate our systems approach to doing this work. And that's how we got connected to start thinking about. That's how we got connected to Jean, how we got connected to Melissa, because they've been theorizing about and have models for how to do this work. So, and then we said we also need to transform our thinking. And who would be better at helping us to transform our thinking than Charmagne and Michael? And so that's how we got here. And I just wanted to contextualize our place-based work and why we have moved into that direction. Thank you, Charmagne.
Okay, thank you for that context. So I want to start us by recognizing that there has been a lot of thinking around how to embed systems in evaluation. For about the last 10 to 15 years, it's really taken hold. And as Michael said, even before that, there's a long history of this. But in recent years, we have in the American Evaluation Association the American Evaluation Association is our national organization that supports evaluators across the country, and they are also there's global evaluation associations as well in other continents and regions. There's what they call topical interest groups, and there's one focused on systems and evaluation. And about 5 years ago, they developed a set of guiding principles for evaluation, systems thinking and evaluation. And these are those, and there's a QR code for the full description of them there. I also, we will share these slides, so I know you're taking pictures, but I'll make sure that you all get them so that you don't have to take pictures or look at your blurry picture. But the overarching principle for thinking about systems and evaluation is to view the evaluation situation through the lens of systems thinking. So that's where we started today, is thinking about, rather than starting with this linear idea, how do you start from a systems perspective? What different questions do you ask rather than thinking about, individual changes? How are you starting with these questions about systems? Within that, there are 4 operating principles, which are below here. The first is around interrelationships. So to critically deliberate on, work to examine, understand, and appropriately address interrelationships regarding both the evaluand, so the thing that's being evaluated, whatever that place-based approach is, and the evaluation itself. So how are we thinking about how things are connected and interrelated? The boundaries is really important. As Michael said, you can't do everything. So thinking about what are the boundaries? Think about, deliberate, set, and explain those decisions that are made, what's in and what's out, and how that relates to the situation and what's being evaluated. Because if you're evaluating something kind of outside of what you are able to have influence on, that's going to affect what the impact that you have. And so really thinking about making sure those are clear and that there's been discussion about that and that the evaluator and the team that's doing the work have had that conversation. What are the boundaries? Then the perspectives principle, which is to really think about what are the different perspectives? What are the different ways people understand the system? Whose perspectives are important? And how do you bring those into both the intervention and the evaluation? How are you thinking about the perspectives and how they influence the work? And those 3 interrelationships, boundaries, and perspectives then feed into the dynamics principle, which is that these things are not static. You don't do it once and then come back 5 years later and think about what's changed. It's an ongoing process. So you're focusing on what are the changes happening, what are the patterns that you notice around the changes in relationships, in perspectives. Maybe the boundaries do change because you've learned something new or you've brought in a new partner and the boundary has expanded. So think about that and what is their influence on the evaluation, thinking about how are you then taking that information and using it to adapt the intervention and what the results are. So those are high level, the principles for thinking about evaluation in a systems context. So if we think about this within PBA, think about, I like to start with boundaries. What are the boundaries of the system as we understand it? What are the implications of those boundary decisions, and how might those boundaries change over time? This is a way to start that conversation. Then think about whose perspectives within the system are important to understand, and what are the power dynamics and the consequences for the initiative. And then what are the relationships within the system, and how are those going to be captured, mapped, and tracked as they evolve? And then again, we get into the dynamics. What changes are emerging? How are they influencing the initiative? So I wanted to give you a chance to think about this in the context within which you work. Think about these questions and begin to make a systems map of, what are the boundaries of the system? Who are the different players, the perspectives, and then what are the relationships? Just start to think about that. And I know that we had several different conversations about who is at different tables. And so this might be a chance, if it makes sense, to move folks. I don't know, did we make a decision on that? Do we want to move folks around or just keep you at your tables? I think that if there are people who you are working with who you want to have this conversation with, go sit with them. But otherwise, you can have it within the context that up here at your table. Whoever happens to be at your table, maybe pick someone who is working in a PBA that you can kind of help think about this. And I have some paper and I'll hand that out. And just start to brainstorm the boundaries, the perspectives, and the interrelationships within the context that you're working. I have another framework I want to layer on top of this to take it one step further. So there's a old saying or an old story of two fish swimming in the water, and one fish says to the other fish, "How's the water?" And the other fish says, "What's water?" And it captures this idea that often we aren't even aware of the systems that we're in when we're in them, right? It's just how we are. It's just how things have always been. And so that systems awareness piece is really key when you're thinking about systems change, and that's some of what we've been talking about. But the framework that I really have found resonate in a lot of communities is the Water of Systems Change framework that was developed by folks, John Kania, Mark Kramer, and Peter Senge at FSG at least 6 or 7 years ago. Raise your hand if you've seen this or are familiar with this. All right, a lot back in that room. I might make y'all split up. My evaluators back there. So for those of you who aren't aware of this, it's essentially kind of an iceberg model that you can see where at the top are more of the structural changes that can take place in systems that are a little bit easier to see and easier to measure: policies, practices, resource flows. In the middle are relationships, connections, and power dynamics, which are a little bit more semi-explicit. Like you can often see and recognize and measure them, but they're a little harder, a little bit less quantitative, if you will. And then at the tip of the iceberg, a lot harder to see and a lot harder to measure are mental models. And so I will walk you through what each of these means and kind of how they can show up in systems evaluation. But I tried to sort of think about, if you were to map the 3 outcomes that you have, like the long-term outcomes in the PBA model to that, in a way, increased awareness is a little bit less than changed mental models, but it's connected. It's this idea of like, how are we thinking differently about health and well-being in our communities? The trust and respect around, relationships, how are power dynamics shifting, how are we being together differently in our communities? And then what does that mean in terms of what's actually happening in practice and policies and the way that resources are distributing lends us up to actual, changes in the community in terms of how it affects people's daily lives and healthier communities. And so I think you can, in some ways, map all the different things you're thinking about within systems to these 6 conditions as a way to provide some cohesion around the different initiatives. And that's what I wanted us to think about today. So as some examples of this, we think about examples of mental models. Mental models are deeply held beliefs and assumptions often taken for granted, ways of operating, things that influence how we think, how we talk, how we are in the world. So one example would be the changed perception of healthy eating from focusing on calorie counting to prioritizing nutrient-dense whole foods as one way to think about a shift in a mental model. Then we move up to power dynamics. So this is the way that decision-making power is distributed, who has authority, both formal and informal influence among individuals and organizations. And when you think about equity, that's really a key place where equity shows up, is about who holds the power and who has the control to reshape what that looks like. So one example would be a shift from more of a top-down decision-making model to a structure that emphasizes community-engaged planning and delivery, ensuring programs reflect local needs and preferences. And a lot of that is what you all have already been trying to do in that transition. But what does that look like then in the different contexts, and how does that play out? And how can you see that changing over time is something that we want to be looking at. Also at the semi-explicit level are these relationships and connections. So this is about quality of connections, not just quantity, and the way that actors are communicating amongst themselves within the system, especially those with different histories, different viewpoints, crossing silos from different areas of the system. So an example, high level, is a shift from siloed programming to working across organizational and program silos, building long-term relationships and focusing on healing from past harms or relationship, looking really at the history of relationships. And you can start to think about what some of those examples might be in your communities. And then we move up to the level of structural change, where we have policies. This could be government, institutional, organizational rules, regulations that are documented, made pretty explicit, that guide an entity and others' actions. So an example of a policy shift is a school adopted a new policy that prohibited teachers from reducing a student's recess time as a penalty for not completing homework, to ensure students have the opportunity for physical activity during the day as an institutional policy. Then we look at practices. So this is more espoused activities of institutions, coalitions, networks to improve social and environmental progress. So an example would be a shift from running an educational program about obesity prevention to establishing physical activity hubs at local schools to provide safe and affordable spaces for exercise. So it's a shift in practice from more of an education focus to more of an opportunity and experiential focus. And then finally, resource flows. So how money, people, knowledge, information, and other assets such as infrastructure are allocated and distributed. And it's great we have some funders in the room who are familiar with this. So an example, this is from the one of the PBAs that we got some information about, is Somali-owned grocery stores in St. Cloud that receive grant funding to upgrade infrastructure to enhance their ability to provide healthy, culturally appropriate food, including energy-efficient refrigerators. So these are the 6 conditions, and they're interconnected. So as you start to think about what's a mental model, how does that influence, mental models will influence the way that we are in the world and the way that we're in relationship, which then influence the way that policies and practices and resource flows happen, which feed back down to influence power dynamics. So it's not like these are siloed, distinct things, but it can be really helpful to think about, within the initiatives that you're working, where are the leverage points within the system that map to this, and how can you look across the different contexts and think about, what's happening with regard to policies in different contexts, what's happening with mental models and how are they interacting. And so it lends some cohesion across contexts, but also allows you to really think about where your leverage points are within a system. And then it connects back to these questions of boundaries, perspectives, and interrelationships as well, because you see, the boundaries of the system are going to determine, in what aspects you're able to shift systems. The perspectives is really key when you think about those mental models and, whose perspectives are present and how those are shifting over time, and then those relationships again, you see those showing up over and over again as a key piece of systems change work. So what questions do you have about that and how these things fit together at this point. Yes.
So,
You want to use this?
surprise, everybody. I have a question. So when thinking about this and thinking about the fact that systems change, to your points, is emergent and it's place-based, are these ideas that are going to be explicitly discussed at the beginning of a project in terms of when you're designing your evaluation, or are these things that you're finding later in terms of like a retrospective, or how does that work?
I think I've seen it happen in both ways. So I think, the more that you make things explicit when you're thinking about mapping of the system and understanding where the leverage points are, this can be a really helpful way to think about where can we influence these things. But as things have already been happening and maybe it wasn't made explicit at the beginning, you can do a retrospective to look back and harvest some of those outcomes about where they've connected. So I have a school district that I worked with near, in the Twin Cities area that had a set of core values, and they really wanted to think about how those were showing up in the work and really understand that. And so what we did was we first started with a retrospective to look at where we could see the core values over time and how they mapped to these 6 conditions. And we did a set of story circles where people were telling stories, teachers, students, administrators, telling stories that were related to the core values. And then we mapped those. We had a team that mapped those to these 6 conditions to say, oh, well, they're showing up really heavily in relationships and connections, but they're still not at the policy level. Or, the dominant mental models really are still not very aligned. But then they're now using this going forward to think about, okay, given that information, given what we saw, where maybe do we need to do more work? Because the idea is that for sustainable systems transformation, you kind of need all of these things, right? But that not every one organization or initiative is necessarily going to be good at doing all of them. And that's where that systems piece comes in, is who are the partners who are working on policy change that might not be you, but might be something you should be connected with. And that will help you understand that a little bit better and think about, maybe that's not where you're evaluating your work, but it's connected to your work, and you can look at the connections between that. So I would say looking back and looking forward, it can be useful depending on where the context is. Mary.
I know that there are many here that have kind of utilized the principles focus or principles-based evaluation. Does that get at systems at all, or what is the value of this value over and above a principles-focused evaluation?
Yeah, so principles are very useful in systems change work where you don't want to necessarily apply a specific model, but you have a set of guiding principles that are informing how you make decisions and how the work is emergent, so that you're not prescribing everything that you're doing, but you're looking at how they're aligning with the principles, and those can undergird all of this. So the idea is that these are the elements of the system that you're working to change, but the way that you're doing that is principles focused. So the way that happens, so they can definitely be connected, and that's kind of the school district didn't have principles. We were working towards getting them towards that. They had core values, but same thing, kind of showing how are the principles showing up in these different areas, right? And you can kind of almost have a matrix where you're mapping where do we see the principles showing up and where are we having a harder time seeing the principles and why? And that then can help you think about, ways that you might need to adjust or learn or do things differently. Yeah.
I'm not part of the official place-based approach part of our organization. So when I'm looking at these 3 areas, boundaries, perspectives, principle, and interrelationships, I'm unclear on what parts of a system, where I should start. Like within the system of extension, that's part of it, or our partnerships, or I don't know, national extension, or do you have any opinion?
Well, it definitely depends on your role and kind of where you sit. What are you hoping to influence, like who are you working with? Like if you're working with an initiative that is trying to influence a specific system, or if you're within extension, starting with extension as the system that you're thinking about, what are the elements within that? So I think it's really thinking about, I guess, starting with that question of like, what is the system within which you're working, and that's that boundary question. And then from there you can think about the other ones. But I would probably need to know a little bit more about like where you do sit, and like what your role is, and how you would then engage with this. I don't know, you want to say something about that?
Let me comment as well on the question about doing this before or after. This is also a framework for doing the baseline. So that these are the things that you capture in the baseline. And in the baseline work on systems, the middle level is the hardest to get at the baseline. The power dynamics and those relationships. So you can map pretty explicitly policies, practices, and resource flows, and get at what the dominant narratives are. What systems change finds is that there's what's called the systems neutrality principle. That systems aren't inherently good or bad. All systems serve somebody's interest. And so a system that from a certain value point of view is a bad system exists because from somebody else's position, they're making out with it. It's working for them. And so one of the things you find is the power dynamics emerge as you start to change the system. As does the vested interests of the people who are benefiting from the system emerge, that's where you begin to get pushback and find out what some of those power dynamics are. The boundaries piece, and where you begin with that, is the understanding that systems are social constructions. They don't exist. We make this stuff up. So that's why the boundary is so important. They aren't out there. There's something we do to try to make the world manageable, to figure out where we're going to work. And it typically begins with work that we've done on social movements, for example, is you begin with a problem you're going to take on. So it's a problem, whether it's obesity or halal food or water or productivity in a farm or nutrition.